My name is Keith Carson, Director of Partnerships with Therapy Specialists, and I'm here with our founder, Susan Harris. Sue, thanks for joining me for a moment. I just wanted to have a conversation with Sue as it related to occupational therapy. So Sue, as you know, Occupational Therapy Month is here upon us. It's April, as it is every year, and we wanted to take an opportunity to just learn a little bit more about occupational therapy from your perspective. So the first question that I wanted to ask you was about how occupational therapy has changed from when you started, which I understand was back in 1968.
That's correct.
And
That was my first job.
Our company started in 1976, and here we are in 2018. And as healthcare has changed over the course of those decades, I know occupational therapy has changed along with it. So can you talk just a little bit about some of the differences between practicing then and practicing now?
Sure. In 1968, the majority of OTs worked for large institutions, big acute rehab hospitals, mental health hospitals, pediatric hospitals, and that's VA hospitals, so big institutions. And in 1968, my first job was with a company that had all three disciplines that provided services in the community, which was very different than working in a hospital. And the reason that opportunity came, that my company took, not my own company, but the company I worked for, was because of the passage of the Medicare Act in 1965. So when I think back about what all of the changes in OT, yes, many of them came with population of people who were handicapped, disabled, had difficulty doing things, difficulty learning. All of those things are the bailiwick of OTs. But it was the funding mechanisms that actually gave wing to a lot of the practice components, and then research followed.
So in thinking about how OT has evolved from back when you started your practice until now, I would assume there are some things that have remained consistent, but certainly some things that have changed, that maybe the schools now are teaching occupational therapists different tools for their specific specialty in comparison to what they were teaching you at that time.
Yes. So I went to school in the late 50s, early 60s, and a lot of my methods classes, so to speak. So we all got, PTs, OTs, speech, all got, you had an emphasis on science. So everybody had biology, chemistry, anatomy, physiology. So that was your basis. And from there you went and you learned about disease processes and disabilities. And the methods classes for OT was, you'd go into an OT clinic in those days and you would see a jigsaw set up, and you would have, it would have all these weights and things that you could use to increase the resistance that you were having your patient use. Maybe you were wanting to work on just standing balance, but on something that the diseases back then are very, very low numbers today. A whole new set of disabilities and diseases today. So you would have a lot of different, we had a big loom. And can you imagine sitting at a loom and you're focused on getting that shuttle from one end to the next, and you're having to go like this. You are having to do a lot of weight shifting, but your mind isn't on that weight shifting.
Sure.
Your mind is on getting that shuttle through. That's the difference between use of activities and exercise. But you don't find that in OT departments today.
You don't?
No. Those are all, we find very much low cost, much lower cost activities to do. And there's such a vast amount of people who need OT and get OT versus back then.
Yeah.